Alright. Alright, I'm going to perform my hand hygiene as I'm entering my patient's room. Hey, I'm Cheyenne. I'm going to be your student nurse today. Can you go ahead and verify your name and your date of birth for me?
Erica Pravat, 12/11/97.
Okay, good. We're going to be performing a head-to-toe assessment. I'm going to start at your head, work through your systems all the way to your toes.
Okay.
Do you have any questions or concerns for me at this time?
Mm-mm.
Okay. I noticed in your chart you had 3 tattoos. Have you noticed anything abnormal with those? Rashes, redness, bumps, drainage? Nothing?
Mm-mm.
Okay, good. I noticed after the nurse took your vital signs, you got up and went to the restroom and it looked like your mobility was good. Do you feel as if it's good?
Yeah.
Okay, good. The vital signs, when I reviewed them in your chart, they all were within normal limits. She took your temperature, your pulse, your respirations, your blood pressure, and your oxygen saturation. Is it normal for yours to be in normal ranges?
Mm-hmm.
Okay, good deal. Do you need to use the restroom or anything again before we get started?
No, I'm good.
No? Okay. We're going to start with your head,
Okay.
and we're going to move down.
All right.
So I'm going to start with your eyes.
Mm-hmm.
If you can, just find a spot over my shoulder and just focus on that for a second. Okay. Pupils are round and reactive to light. If you can just look at my pen, follow it. Don't move nothing but your eyes.
Okay.
Okay, good. I'm going to check your nose. All right, good. It's no drainage. And your mouth, say ah. Good. Tonsils are not swollen. Your mouth is pink and moist, so that's good. Before I go any further, I didn't ask you if you were experiencing any pain today. So if on a scale of 0 to 10, 0 being no pain and 10 being the worst, are you feeling any pain today?
0.
0? Okay, good deal. I just wanted to check. So now I'm going to start with palpation. If you feel any tenderness through this area, just let me know, okay? Okay. Okay. Didn't anything feel swollen? Was there any tenderness? Okay. I'm going to check your skin trigger. So it's just going to be a small pinch. You shouldn't hardly feel it though. Okay, good. It was no tinting. It recoiled immediately, so that means there's no signs of dehydration.
Good.
I'm going to check the anterior chest now. So I'm going to start with the skin. It is appropriate for your ethnicity. I don't see any lesions or marks or scars on it. Your breathing looks even and unlabored. I'm going to check your costal angle, so if you'll take a deep breath for me. Good. It's 45 degrees. Okay, so we're going to start with your aortic, but I just need you to breathe regularly for me while I'm listening to these, okay?
All right.
So we're going to start right here at the aortic. Okay, pulmonic. Second pulmonic. Tricuspid. Mitral. And epigastric. Okay. Flip my stethoscope around. Okay, good. S1 and S2 sounds are present. I didn't hear any murmurs or any abnormal sounds. So now I'm going to move around. I'm going to do your lung. I'm going to listen to your lungs on the front before I move to the back side. So if you can just take a deep breath for me every time you feel my stethoscope. Okay? Okay. So the vesicular sounds are up here. And I did listen to your bronchovesicular sounds right here beside your sternum, okay? All right. So Breath sounds were clear. I didn't hear any wheezing or crackles. So we're going to go ahead and move to the posterior side, okay?
All right.
If you could, yep, turn for me.
Okay.
So I'm going to start with checking your spine. It is straight. There's no curvature. If you could raise up your shoulders for me. Good. And back. Good. Scapula is even. Skin looks even, appropriate for your ethnicity. I don't see any lesions or scars or anything. So now we're going to listen again. So if you'll just take a deep breath every time you feel my stethoscope again, okay?
All right.
All right. And the vesicular sounds are up here. Okay, and then we got your bronchovesicular sounds. Okay, good. They were clear back here. I didn't hear any wheezing or crackles. Okay, so I'm going to check your upper extremities now. Your skin looks good, appropriate for your ethnicity. I don't see any lesions or marks. I'm going to check your temperature. All right, it's equal, warm bilaterally on both. I'm going to check your radial pulses now. Okay, your pulse is strong and even bilaterally. Okay, I'm going to check your capillary refill. Good, it's within under 3 seconds. I'm going to go ahead and get you to uncross your arms for me. Okay,
Sorry.
there you go. Squeeze, push, pull. Good. It is strength is equal in both arms. Now if you'll close your eyes for me and just tell me where I touch, okay?
Left upper arm, right lower arm, left lower arm, and right upper arm.
Okay, good. I'm going to go ahead and move to the abdomen now. But before I get you to lay back, I'm just going to go ahead and when was the last time you had a bowel movement?
This morning.
This morning?
Mm-hmm.
And about how many times do you urinate a day?
About 5.
About 5? Okay,
Mhm.
good. If you'll go ahead and lay back for me.
All right.
It's okay. All right, so I'm going to inspect the abdomen. I don't see any distension or any hard masses anywhere. I can see a pulse in this area, in the epigastric area. Going to go ahead and start auscultating. Skin looks good, appropriate for her ethnicity. Okay, and I would listen for a minute in each quadrant. I'm going to start at the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, bowel sounds are present. And do you feel any tenderness in your abdomen right now?
No.
Okay, so let me know if anything hurts.
Mhm.
Any pain?
No.
Okay, good deal. I'm going to move to your lower extremities now, and I'm going to start with the temperature.
All right.
Okay, if you can scoot back for me just a little bit.
All right.
Thank you. All right. Skin is warm bilaterally. I'm going to check your dorsalis pedis pulse.
Okay.
If I could not locate this pulse, I would get a Doppler and check it. And then if I couldn't find it with the Doppler, we would go up to your popliteal and then your femoral. But I do feel it bilaterally. It's equal and strong. Now I'm going to check your capillary refills and your toes. Good, with under 3 seconds. Can you pull against my hands? Okay, now push against my hands. Good. And the same thing I did on your upper extremities, if you could keep your eyes closed and tell me where I'm touching.
Right upper thigh, left leg, right leg, and left upper thigh.
Okay, good deal. I think that concludes our head to toe assessment.
Okay.
Do you have any questions for me?
No.
Okay, well, you can go ahead and get dressed, and they'll schedule you your next appointment when you get ready to leave, okay?
All right. Sounds good.
Thank you.
Okay, my name's Bridget. Well, here's my Bridget. Nothing written on it. All good. Hi, how are you?
I'm good.
Good. My name is Bridget. I'm going to be your student nurse today.
Okay.
I'm going to be doing a head to toe assessment on you. Can you tell me your first and last name?
Julia Koselniak,
Okay, Julia, what's your birthday?
5/13/03.
Amazing. And Julia, are you allergic to anything?
Nope.
Okay. Do you know what city we're in?
Saginaw,
All right. And who's the president?
Joe Biden,
All right. And what year is it?
2023.
Okay. I'm just going to be asking you a couple questions before I get started. Do you take any medications?
No.
No? Any over-the-counter supplements, herbals, anything like that?
Sometimes ibuprofen when I have a headache.
Okay. Do you have any past medical diagnosis? Any surgical history? Okay. And do you drink, smoke, or do drugs?
I do not.
You don't? Awesome. Okay. So now that all looks good, I'm gonna take your vitals before I get going. Do you have an arm preference for your blood pressure?
No.
I'm gonna do it on this one right here.
Okay.
Can you flip your arm for me? Thank you. Awesome. I got 118/76. Is that enough for you? Awesome. I'm gonna be getting your heart rate. Stick out your arm for me. Awesome. Okay, for your heart rate, I got 75, and for your respirations, I got 18, which I think looks good there. I do not have a pulse oximeter, so I'm just gonna check your cap reflow. Stick out your hands for me. Good. Come back in 3 seconds, or just less than 3 seconds, which is what we want to see. And do you feel like you have a temperature today, a fever at all?
No.
I'm just gonna feel it. You don't feel warm, so I'd expect your temperature to be around 98.6. Okay, so everything looks good with your vitals. Are you in any pain today?
No.
Awesome. So have you ever had a head to toe before?
No.
Awesome. So what I'm going to be doing is I'm literally going to be assessing you from your head to your toe. If you feel any pain or have any questions the whole time, just let me know. Okay. I'm gonna be starting with your arms. So I'm gonna put my hands on your shoulders and then you just do one motion of swimming and then one forward and then backwards. And I'm gonna feel your shoulders here.
Okay.
Awesome. A little cracking. Is that normal for you?
Mhm.
Okay. I'm gonna have you stick your hands out like this and then push on mine. Push on yours and then flip your hands up. Push up. Alright. And push down. Amazing. You stick your arms out for me. I'm gonna feel your pulses. Alright, your radial is symmetrical and strong. There we go. There's your radial, and they're also symmetrical and strong. Awesome, everything looks good there. Muscle tone looks good. No moles, temperature looks good. I see no problems there. Awesome. So now I'm gonna be moving on to your head. So I'm gonna have you look down for me. I'm just gonna feel your hair. Have you ever dyed your hair before?
Nope.
Awesome. Your head feels good. Are you feeling your occipital lymph node? Any pain back there?
Nope.
Awesome. So be non-tender and non-palpable. Okay, so now I'm gonna be starting with your eyes. You wear contacts?
Yeah.
Okay, no problems with that?
Nope.
Okay. So I don't see any drainage. I'm gonna have you look up for me. Alright, sclera is white and conjunctiva is pink. Everything looks normal there, no drainage. And now I'm gonna be looking in your eye. Go ahead and look at me and at my pen light. Awesome. Keep looking at me. Everything looks good there. I'm gonna have you follow my pen light. Good there. Okay, now I'm gonna put my pen light right here and then have you look at my pen light, look at my hand, pen light, hand. Okay. And then pen light, hand, Awesome. Everything looks good there. Your pupils are equal, round, reactive to light, and light accommodating. Everything looks good. Alright, now I'm gonna be moving on to your ears here. I see you have some piercings. Do you have any issues with those?
Nope.
Awesome. Palpating your pinna. No problems there, no pain? Okay. I don't have an otoscope, so I'm just going to be looking in your ears with my pen light. Awesome. I don't see any drainage, no redness, everything looks good there. Alright, now I'm going to be moving on to your nose. I see you have a piercing there. Do you have any problems with that?
No.
Awesome. And have you broken your nose? No. Okay, I'm going to have you look up. I'm just going to be looking at your nose. No deviations, no polyps, nothing like that, and it looks moist just the way we like it. Okay. Next, I'm going to be. And when I did your eyes, I checked cranial nerve 3, 4, and 6. So when I did your eyes with the snowflake and then the light accompaniment stuff. Okay. All right. Now I'm gonna have you close your eyes. I'm gonna have you smell something and tell me what it is.
Cinnamon.
Cinnamon. Okay. Awesome. And that's cranial nerve number 1. Okay. Now I'm gonna be moving on to your mouth. Have you ever had any cavities?
Yeah.
Okay, but you see the dentist regularly?
Yeah.
Awesome. And did you have braces as a kid? Alright. So I'm going to be looking at your, can you just smile for me? Awesome, everything looks good there. And when you stick out your tongue and say, ah. Awesome, will you lift up your tongue for me? Alright, side to side, everything looks good there. Alright, will you stick your tongue back out at me and move side to side and up and down? Awesome, so that was checking cranial nerve 9, 10, and 12. Alright. Now I'm moving into your face here. Just feeling your sinuses. Any pressure or pain?
Nope.
No? Okay. Feels good to me. And now I'm going to be testing your sensations. So I'm going to close your eyes. I'm going to touch 5 different spots on your face and just tell me where I'm touching you, okay?
Forehead.
Okay.
Nose. Left cheek. Right cheek. Chin.
Amazing. And then will you puff your cheeks out for me? Smile, frown, and then raise your eyebrows. Awesome. And that's checking cranial nerve 5 and 7. And so now I'm going to be checking your lymph nodes. Come back here. And feel your postauricular, preauricular, submandibular, submental, cervical chain. I'm going to pull your gown down. Is that okay?
Mhm.
Okay. And when you scrunch your shoulders for me, I'm going to feel your supraclavicular. Everything looks good there. And while you're there, I'm going to check your skin turgor. Awesome. And when you raise your shoulders like that, that was cranial nerve number 11. So everything looks good there. And so now I'm going to put my pins right here and you clench your jaw. And then when you swallow, no pain, anything like that. Awesome. Everything looks symmetrical and everything looks good there. Okay. Just checking really quick before we move on. Awesome. Okay, so one last thing before I ask you to turn around, I'm going to do your carotid. Good. Amazing. So now I'm going to listen with my bell for any breathes. And when I do that, I'm just going to have you hold your breath for me, okay? Okay, hold your breath. Awesome. Go ahead and take the breath. Alright, hold. Awesome. Everything looks good there. I did not hear any breathes. So I'm going to have you turn around for me. Alright, so I'm just inspecting your back here. Everything looks good. I don't see any moles or anything that you need to be worried about. Spine looks good. Alright, I'm going to put my hands on your back and just have you take a deep breath for me, okay? Awesome. And when you did that, my hands expanded symmetrically, so that's what we want to hear. So now I'm going to be moving on to percussing your lungs here. So I'm going to put 2 fingers on and I'm going to be tapping motion. If you feel any pain, let me know, okay? I'm going to do 12 different spots. I'm going to move this up, okay? Awesome, and I heard resonance there, which is what we want to hear. So now I'm going to be doing the same thing, except for I'm going to be listening with my stethoscope. And every time I move my diaphragm, I'm just going to need to take a deep breath for me, okay? Moving to my diaphragm. Are you doing okay?
Yep.
Okay, I'm gonna continue. I'm gonna lift this up, okay? And last one. Awesome. Your lungs sound clear, which is everything we want to hear. Did you feel any pain with that?
Nope.
Are you feeling okay after all that breathing?
Yep.
Awesome. Okay, so now I'm going to be feeling your thyroid and your trachea here. This might feel a little awkward. I'm going to be coming around here and then move to one side, feel, and then move to the other side and feel. Okay?
Okay.
Any pain with that?
No.
Awesome. So that was everything we needed to feel. No non-tender and non-palpable. So everything looks good there, and I did not feel anything else at all. Okay. So now I'm going to be moving on to you laying down for me. Awesome. Okay. So before we do that, I'm going to move this pillow from you. I'm going to have you look over there. Alright. I'm going to do on that side. I'm going to look at this side. No JVD there either. Here's your pillow back. Alright, I'm going to start by listening to your chest here. So I'm going to listen to 5 different spots. If you can pull that down. Awesome. I'm inspecting the chest. I don't see anything I need to be worried about. Temperature looks good. Okay. So I'm going to listen to 5 different spots, and at each spot I'm going to be listening with my diaphragm and then switch it to my bell. Let me know if you have any questions, okay? You can just breathe normally. Clavicle. Here's rib 1. Here's rib 2. Alright, I'm listening to the aortic with my diaphragm in intercostal space 2. Okay. Switching to my bell. Okay. Come over on your left side. Here's rib 1, there's rib 2. So I'm listening to pulmonic with my diaphragm. Switch into my bell. Good. And down. Intercostal space 3 for herbs. My bell. Intercostal space 4. Listening to tricuspid with my diaphragm. Switch into the bell. Alright, I'm gonna go to intercostal space 5, and I'm gonna leave my finger there. If you can lift up your breath for me. Okay, found my finger. Sorry. I'm gonna go mid-clavicular with my diaphragm. And this is your mitral. I'm listening to my diaphragm, my bell. All right, now I'm gonna be listening at this spot for a minute, okay? Awesome. Okay, I got 74 for that, so it matches with me getting. Awesome. And now I'm gonna move you onto your abdomen here. So I'm gonna have you pull down that. Perfect. Before I do anything, I'm just inspecting. Everything looks good there. And I'm gonna come to the edge of the bed. Everything looks symmetrical. And I can see your abdominal aorta pulsating. So before I do, I'm gonna start listening, and your stomach is divided into 4 quadrants. So I'm gonna be listening to about 4 to 5 vowel sounds in each quadrant, okay? You can just breathe normally for me. Me listening with my diaphragm. Awesome, and I did hear 4 to 5 vowel sounds in each quadrant. All right, now I'm gonna be listening to the arteries in your stomach, okay? With my bell. Switching. And the first one in the middle here. Abdominal aorta. Left renal, right renal, right iliac, and left iliac. Awesome, I did not hear any breweries, and your bowel is very active. When I listened to your heart, I heard love dub at each spot, and I did not hear any murmurs. So everything was good, both listening to both spots there. So now I'm gonna be doing the same kind of tapping motion I did on your back, except for I'm gonna be doing it on your stomach, okay? And I didn't hear anything, so I feel safe to continue with the tapping, okay? So I'm gonna do 3 spots in each quadrant. Let me know if you feel any pain, okay? Awesome. And I heard tympani in your bowel, so now I'm going to be progressing up to find your liver. Okay? I'm just put my fingers down here for a minute. Alright. And there it is, right there, right below your rib. Okay. And I didn't feel anything like that. Everything sounds good, so now I'm going to be moving on to some light palpation, okay? So let me know if you have any pain. Doing okay? All right, now I'm gonna do a little deeper, okay? No pain there?
No.
Awesome. I didn't feel anything else either, so everything looks good there. So I'm gonna be doing your femoral arteries. So these are like right on your hip line. So I'm gonna find that. I'm gonna have you lift your legs up. All right, and I'm just gonna stick my hands underneath here, okay? So they're symmetrical and strong. For this one, my finger's right here. For this one, my finger is right here. Everything looks good there. So now I'm gonna listen to each of them. Find it again really quick. Here. Here's my bell. Just gonna stick this in. Sounds good there. I'm gonna find it again over here. Just awesome. And I did not hear any breweries there. Everything sounds good. All right, now I'm gonna move on to your legs here. Just inspecting your legs. Temperature looks good. Muscle tone looks good. Amazing. I'm gonna feel your pulses in your legs, okay? Start with your popliteal. Awesome, symmetrical and strong. I'm gonna come down here. Posterior tibialis. Feel symmetrical there. And I'm gonna feel your dorsalis pedis. Everything feels symmetrical and strong there as well. So now I'm gonna do a sensation test on you. Okay? So I'm gonna have you close your eyes, and then this is gonna be sharp, and this is gonna be dull. Okay? And you just tell me where it is and if it's sharp or dull. Okay?
Left, all. Right, sharp. Right, lower side dull. Left, lower side sharp. Left shin sharp. Right shin dull. Right foot dull. Left foot dull.
Awesome. Everything right there. I'm just gonna be inspecting your toe. Everything looks good there. Your feet look good. So you can move your butt. And this to the side. All right. So now I'm gonna have you swing to the edge of the bed here, but don't stand up yet. Okay. Amazing. I'm checking your leg muscle again. Everything looks good here. All right, and I'm gonna have you push down on my feet, on my hands. I mean, awesome. Pull up. Good. And now I do see you have your toes painted, so I'm gonna check your crab reflex underneath. Good there. Awesome, good there. And then will you come a little closer so that you can dangle your leg? Awesome. So I'm going to be checking your patellar reflex. Awesome. You doing okay?
Mm-hmm.
Good. All right. So before I stand you up, I'm going to do your cerebellar function, okay? So with my pen light, I'm going to have you touch my pen light, touch your nose, pen light, nose, pen light, nose. Awesome. And then you make a okay sign with me and then go all the way down as fast as you can. Awesome. And then hands on the thigh and then flip. Good. So based on everything in the head to toe, I feel that you are safe to walk with me. So I'm going to do your Romberg test, but before we do that, I'm going to make sure you have your shoes on. Mm-hmm. Everything now good there?
Mhm.
Okay, so you go ahead and stand up. Are you feeling okay?
Mhm.
Okay, so this is going to be the Romberg test. I'm testing cranial nerve number 8, okay? So I'm going to have you stand butt shoulder width apart with your hands onto your side, and then just stay there with your eyes closed, okay? Awesome. So you didn't have no swings. I'd give you a negative on the Romberg, which is what we want to see. So one of the last things I'm going to have you do is I'm going to have you walk to my stove and then walk back, okay? You can just walk normally. Alright, and then you can go heel toe walk for me. Awesome. Are you feeling okay?
Yep.
Awesome. So that is the end of my head to toe. I'd give you a braiding scale of 23 because I don't see any problems with your movement or your moisture or anything like that. Friction and shear, nothing along those lines. Sensation looked good, everything looked good to me. So overall your head to toe is normal and I see no issues with that.